I want to continue talking about the different subject, the next topic, sorry. Remove of gutta percha fillings. So this is reason why you need to remove gutta percha fillings in retreatment. You don't need gutta percha fillings in retreatment. So you need to completely remove gutta percha fillings because gutta percha carry bacteria biofilms. So you must remove all the gutta percha fillings in retreatment. So again, root fillings to the root canal terminus do not always lead to successful outcome because gutta percha does not bond to dentin. And gutta percha can be easily contaminated. Sometimes gutta percha can be what we call gutta percha centered infection. So for example, here you see infection, you see the discolored gutta percha fillings against root canal walls. Definitely gutta percha is contaminated. You don't want this to happen, especially in retreatment. If you see gutta percha in this condition, you need to remove gutta percha completely. In this case, look at the gutta percha fillings. You see the pre-op radiolucency, but gutta percha was extruded. I tried to remove the gutta percha in one piece, but I failed. I separated gutta percha from the main canal. I filled the root with MTA. I waited 6 months, nothing changed. Of course, the lesion size was smaller, but it stayed the same size after 3 months. So I decided to remove the gutta percha filling. What I did was very simple. I just removed the fillings, separated into the periapical tissues. I didn't do root end surgery. I just removed the gutta percha fillings separated from the main canal. And this is the gutta percha I removed from the periapical tissues. And this is 3 months, 1 year post-op showing nice periapical healing. So I guess gutta percha was the only cause of persistent apical periodontitis. Nothing wrong with the tooth. But gutta percha was the main cause of persistent apical periodontitis. If you push the gutta percha into the maxillary sinus, you could have aspergillosis. If you have aspergillosis, you could have inflammation. So I removed the gutta percha from the maxillary sinus, and this is the gutta percha I removed from the sinus. So, gutta percha can be easily contaminated if it's extruded, if it is used in retreatment. So how do you remove the gutta percha? I use these instruments. I use, for example, micro gutta percha remover from Cora. I use TFRKS from woodpecker. And I use hand instrument like a GPR from TFRK, like this, or I use micro opener. So here you see the hook. This can be very good. If you see a hook on the instrument, you just press it against the root canal wall. Sometimes you can scrape the necrotic pulp tissues with a hand instrument. Or you could use ultrasonics to remove calcified canals or calcified debris, calcified necrotic pulp tissues. And this is the small hand instrument from TFRK. It is called TFRK GPR. It has small triangular tape. The pyramid tape. So because of the triangular shape, you could press it, you could scratch the root canal wall with this, and you can remove gutta percha and necrotic pulp tissues. In addition to that, I use chloroform. Many people are concerned about carcinogenicity of chloroform, but it's okay. Many studies supporting that. Although the carcinogenicity of chloroform in human is suspect, but chloroform is regarded as a safe and effective endodontic solvent when used carefully. Actually, I use it every day. I use it in every case, in all the cases in retreatment. The use because, there is a benefit of using chloroform. The benefit of using chloroform is this. You can remove E. faecalis, Enterococcus faecalis, because Enterococcus faecalis is responsible for biofilm formation in the root canal. So if you can remove it with chloroform, it's very nice. You can soften gutta percha and you can remove E. faecalis. It's a big benefit. And also, chloroform is very effective in softening gutta percha fillings, inexpensive, and it vaporizes very quickly. If you go to the United States, every university hospital, you find chloroform. Every university hospital and every endodontic office, private office, you see chloroform. And you will see how fast it vaporizes. This is a drop of chloroform. So you see it's vaporizing very quickly at this speed. So it's okay. I always use it. I never had a problem with chloroform. No post-operative pain, nothing. But when chloroform is used during the early stage of gutta percha removal, more filling material will remain in the canal, and some of it may be extruded beyond the radicular foramen. So don't use chloroform from the beginning. You need to first remove gutta percha mechanically. Then when you see gutta percha remaining in the canal, in the apical 1/3, then it's time to use chloroform. I did a study on that, but it's not published. So when I see gutta percha remaining 3 millimeters in the canal, I use the chloroform, I agitate it with a hand instrument. 3 minutes after the agitation, all the gutta percha fillings completely gone. So whenever you see the gutta percha remaining 3 millimeters, maybe 3 to 4 millimeters, 2 can be okay. You don't have to be accurate. However, if you see the gutta percha 8 millimeters in the canal, and if you use chloroform agitated 15 minutes after the agitation, you see lots of chloroform remaining, lots of softened gutta percha remaining inside the root canal. You see gutta percha softened around the apex, around the orifice, and even inside the root canal. So many gutta percha remaining all over the root canal walls. So it's not a good idea to start using chloroform from the beginning. So you need to start with mechanical removal. How do you do that? This study showed the instrument with a lesser taper removed significantly more gutta percha fillings compared to the instrument with a bigger taper. They use the instrument with taper 08, 04, 01. Okay? But, they removed more gutta percha fillings with the instrument with a 1% taper. So that's why I want to use the instrument with a smaller taper, which is this, XP shaper. XP shaper has only 1% taper. This is more sufficient and more, you will be more efficient in removing gutta percha mechanically using XP endo shaper because it has 1% taper. And it has a snake-like shape, this shape. So because of the snake-like shape, you can touch the root canal walls and you can scratch the root canal walls. Then you can remove the gutta percha mechanically very easily. I will do the demo after this. And as you can see, this is XP finisher. Finisher is also okay. But finisher has no ability to cut dentin. So you can be minimally invasive. So after using XP endo shaper, I want to use XP finisher in the presence of chloroform. Because this way, you can touch almost all over the root canal walls, scraping the gutta percha remaining on the root canal walls. And Azim showed XP shaper rotating at higher speed, 3000 RPM, removed significantly more gutta percha than wave and gold and high flex EDM, conventional nickel titanium instrument. So you need to increase the speed, not the speed that the company recommends. So I want to use 3000, 2500 higher speed. What about extrusion? XP and shaper extruded significantly less debris from the epical filament than conventional reciprocating instrument, like a reciproc or wave and gold. Because of the snake-like shape, you have spaces around XP and shaper. That's why you won't extrude debris into the periapical tissues. So this concludes the protocol that I want to show you. So start with the tip, the ultrasonic tip, like a TFRK, to create a space between the gutta percha and the root canal wall. Then you will use hand instrument, and then you will use XP and shaper to remove gutta percha mechanically. Whenever you see the gutta percha remaining 3 millimeters in the apical 1/3, it's time to use chloroform. You can first agitate chloroform with a hand instrument. Then you will use XP and shaper, followed by XP finisher in the presence of chloroform. Then you will remove everything. So this is the protocol I always use. So let me show you a video from here. So basically, I use the retreatment kit. I use gutta percha removal hand instrument. First, I use GG bar, number 3 GG bar in the kit. Then I will use TFRKS, small size ultrasonic tip. Then I will use hand instrument, GPR, to remove the gutta percha mechanically. Then I want to use XP and shaper, hopefully to remove the gutta percha in one piece. But if the gutta percha remains 3 millimeters in the apical 1/3, it's time to use chloroform, agitated with a hand instrument. Then you will use XP and shaper, followed by XP and finisher. Because with the XP and finisher, especially, you can touch all over the root canal walls. So because of the touching the canal walls, you can remove gutta percha remaining on the root canal walls. So this way, you can remove it. What about the case with the gutta percha extruded into the periapical tissue? This is basically the same. Try to remove the gutta percha in one piece. But if it's separated, it's okay. So first, use TFRKS to create a space between the gutta percha and the root canal wall. Then you will introduce GPR, hand instrument. Try to get gutta percha out in one piece. But if it's separated, when you see the gutta percha remaining 3 millimeters inside the root canal, use chloroform, agitate it, you push chloroform into the periapical tissue, use XP finisher, rotate it outside the root canal, spin it, then gutta percha will be completely gone. Because it's important to agitate chloroform to soften the gutta percha. If it's softened, macrophage will take care of the remaining gutta percha. So let me show you how I do this. So this is the gutta percha. This is apical radiolucency here. First, I create a space with the TFRKS, the straight tip. So the space is created between the gutta percha and the root canal wall. Then I'm going to introduce XP shaper. I'm rotating the XP shaper at 2,500 RPM with a small up and down motion. If the gutta percha came out in one piece, it's good. But if not, it's still good. So I put chloroform. I know gutta percha remaining less than 3 millimeters. Chloroform has no color. But if you spin it, the chloroform turns to white, like this, meaning you still have gutta percha fillings inside the canal. So you can irrigate the canal with chloroform. You can agitate it with a hand instrument. This is GPR. I'm agitating chloroform. So it turns white again. Then irrigate the canal with chloroform and do the same. If it stays transparent, then there's no more gutta percha remaining inside the canal. So as I'm agitating chloroform, there's no change. So I think I removed all the gutta percha fillings. So I finished with a XP finisher to make sure there's no more gutta percha remaining on the root canal walls. I spin it with chloroform inside. I even extruded the instrument beyond the apical foramen. So that's why you see the blood coming out. Then I take a look, and I take radiograph and take a look. Then this is sodium hypochlorite. Then I use hydrogen peroxide. And I took a radiograph. There's no more gutta percha remaining in the canal. So this is immediate post-op. This is MTA. This is 1 visit treatment. And this is 3 months post-op. This is 3 months post-op. You see the bone. You see the defect before the treatment. And this is 6 months post-op, showing nice periapical healing. Look at the bone. Another case, you see the gutta percha completely extruded from the palatal root. Look at the gutta percha. Look at the sinus. So let me show you what I did. Basically, I did the same. So look at the gutta percha fillings, completely extruded into the sinus. And this is the gutta percha. First, I created the space between the gutta percha and the root canal wall. Here comes XP shaper, hoping to get it out in one piece. Up and down, and gutta percha is coming out. Thank God it came out in one piece. I took a radiograph and everything is gone here. You see the mucositis here because of the extrusion of gutta percha fillings. And this is 3 months, only 3 months post-op. Mucositis is completely gone. No more lesion. Lesion is completely gone. Okay? And this is palatal root. Another case, you see gutta percha extruded from the perforation and from the apical foramen. And you see the lesion associated with the perforation here. I use the same technique. Let me show you the video here. Look at the extrusion, lots of extrusion. And this is already I already removed the gutta percha mechanically, so this is already chloroform. I'm spinning the XP and the shaper in the presence of chloroform. Of course, I'm spinning the XP shaper outside the root canal because the gutta percha is already outside the root canal. That's why you see the blood coming from the periapical tissues. But I continue irrigating the canal with chloroform. This is chloroform, not sodium hypochlorite. And this is perforation. I try to put it in the perforation. And I do the same, spinning it at 2000 RPM with a small up and down motion. Then always irrigate the canal with chloroform. I don't anesthetize the patient, by the way. The patient is not screaming. Can I have the sound? There's no sound. I want you to hear the sound because I want to make sure the patient is not screaming. Because I didn't anesthetize the patient. I'm spinning the XP and the shaper outside the root. That's why you see lots of blood coming out. Lots of blood. No sound? Okay. Okay. So then keep irrigating the canal with chloroform. So this way, you can remove and softening the gutta percha fillings. Then take a radiograph to make sure all the gutta percha extruded was removed. So I took a radiograph. As you can see, all the gutta percha extruded into the periapical tissues were completely removed. And this is immediate post-op. Of course, I filled the root canal with MTA. And this is 3 months post-op. And this is 6 months post-op. And this is 10 months post-op. You can see nice periapical healing as compared to this. So extrusion of chloroform into the periapical tissue didn't affect the outcome, prognosis. Nothing happened. I do this all the time, every case. Whenever I see the extrusion of root fillings. Another case. This patient was politician, very famous politician, big shot. But I didn't care. I didn't anesthetize the patient. And the patient, actually, I hated him. He was too arrogant. But, I don't care. So somebody pushed gutta percha fillings into the periapical tissues. So he was already upset. But it's okay. So I use the same technique. First, I tried to remove the gutta percha in one piece with a XP shaper, but it was separated. So here, you see the gutta percha inside the root canals were completely removed. But you see the gutta percha remaining in the apical 1/3. But it's okay. I know I could remove the gutta percha fillings. So what I did was, let me show you the video. I use the same technique. I pushed chloroform into the periapical tissue, and I spun it. Chloroform used to be used as an anesthesia. Make sure you don't damage inferior alveolar nerve. So you need to measure the length to the inferior alveolar nerve. So this is XP shaper. I'm spinning the shaper at 2,500 RPM in the presence of chloroform. So like this. Then you need to irrigate the canal with chloroform. Keep irrigating the chloroform. Now I'm touching the periapical tissues. So look what I got. Gutta percha fillings came out from the periapical tissue. This is the gutta percha. Look. So I was successful in retrieving gutta percha pushed into the periapical tissue. You see lots of bleeding, but the patient didn't complain about the pain. He said, I thought he was arrogant, but he said, you are super nice doctor. I trust you. I don't feel pain, even though you see lots of bleeding from the periapical tissue. Bleeding doesn't mean lots of pain. Actually, when you see the bleeding, there's no pain. And this is the radiograph I took after I removed gutta percha from the periapical tissues. This one and this one. Then I filled the root canal with MTA. And this is a 3 months post-op. Almost there. You see nice periapical healing as compared to this, and this. Of course, the patient was already asymptomatic, no more pain. Another case, then we take a lunch break. You see big lesion. And again, gutta percha fillings already extruded into the periapical tissue. However, I separated the gutta percha fillings from the main canal. And the gutta percha, you see the gutta percha cone was not into the apical direction of the main canal. It's not in a straight line. So I thought I was not able to touch the gutta percha here and here, especially this one. It was impossible to touch this gutta percha fillings. So I decided to close the root canal with MTA. But before I filled the root canal with MTA, I intentionally pushed chloroform into the periapical tissue, hoping gutta percha would be softened. And the patient came back 2 weeks after this. I took a radiograph, but I didn't find the gutta percha fillings. It was here and here. But when I took a radiograph 2 weeks after filling the root canal, no more. 3 months, 6 months. Then I took a CBCT, but there was no gutta percha. And this is 9 months post-op showing nice periapical healing. Gutta percha completely disappeared. So extrusion of chloroform into the periapical tissue didn't affect the prognosis. Of course, the patient was asymptomatic. I do this thousands of times. Nothing happened.